the Board of Visitors, invited and distinguished guests, staff at St. Jiles Hospital, NGO representatives, state-based organization representatives, media partners, and of course our lovely patients here for St. Giles. Nisam Bulavinaka, and a very good afternoon to you all. As I looked out this morning, there was rain outside. And I said, oh my God, I hope they don't cancel the bus ride. Because I know the patients were looking forward for the bus ride. Actually, I was looking forward to the bus ride and lunch at Mysore Park. But unfortunately, fortunately, as we look outside, we have been indeed blessed with a beautiful, beautiful weather. And as I look around the room, I can remember the faces of our patients here, and I see the smiles on their faces. And I think that's very important. But before I go on to the gist of my speech, can I ask you to just turn around to the person sitting next to you and ask, are you okay? You feeling good? That's very important. Are you guys okay outside? Yes? Oh, good. See, one of the most important things that we miss out is asking our loved ones if they're okay. We are so busy. I wish somebody asked me that every minute. Nobody asked me. Maybe you can ask me if I was okay. And I would say, yes, there are days when I'm okay. No, there are days that I'm not okay. And that builds up the stress. And sometimes we fail to recognize that signs of stress in our loved ones. And we leave it far too long. And then the damage is done. But anyways, the whole idea of being here is to just kickstart our Mental Health Day awareness and celebrations, as mentioned by the acting SDMO. Lambasa will this year host the Mental Health Day awareness celebrations on Fiji Day, and we thought to have a soft launch here. And so, ladies and gentlemen, when we talk about health, and when we talk about mental health, so health and mental health are two different things. We talk about health, we talk about good food, we talk about exercise, we talk about whether we're having enough rest or not, whether we are cared for in the family. But when we talk about mental health, sometimes we don't realize how important mental health is. Okay? And I've been told currently we have 71 inpatients here. And our daily clinic sees a lot of number of outpatients. There are people out there. If I may just share a story, 2 days ago, a gentleman visited me from Rosy. And well, there was no appointment and stuff, but I saw it fit to see him. So he comes to my office and he relates a very sad story to me. A very sad story, and he says, Madam, if you can just come, take out some time and come with me. I will show you how this person is suffering. So after lunch, me and my team, we said, okay, let's drive down to Rosy. And guess what we saw? What I saw there, I'm still reeling from the shock of it, believe me. And what my team saw there, it was shocking, very shocking. We had a case, young man. The mother was blind, or is blind. She needed help, and they lived in one house, small upstairs, downstairs. He was kept in an enclosed area. And it would melt any of your hearts if you saw that. Why I'm trying to bring that up is the role of families. Okay? There are services available, and we want to tell the public to make use of our services. And so yesterday we brought him up. The team from St. Giles went there because they could not control him. The only reason they kept him enclosed in the area was because they could not handle it. And we totally understand. Families are not prepared. They are not equipped with the right knowledge and skills to handle mental patients. But that was very sad, and that's the sad reality. There may be many cases. I can't say there are not many cases. So we'd love to use these celebrations and awareness to ensure that families seek attention, medical help for the loved ones. So now we have brought the patient here, and now he's being under the care of the doctor. So at this point in time, if I can also thank the staff here. I know your job is very challenging. It's not easy. Every time I come and go here, and I see the work that you do, and I must commend you for that. And to the Board of Visitors, from the time I joined the Ministry of Women, that time I've seen the work that you do in trying to bring about improvements to this facility. Ladies and gentlemen, this facility was built in 1884. 1884. it has seen a lot of good days, and now it's seeing bad days. So what we've done is we've proposed that it's time we relocated these facilities. So plans are in progress to ensure that we relocate these facilities. And obviously we are looking at relocating one to the west as well, because we want to provide the services to the west. A lot of families from the west bring their loved ones here and they leave them here. Now, our patients here need that family laughter. They need to see familiar faces. And I mean, I see a few of the patients here who are longing to go back. A week ago when I came here, they started giving me the phone numbers. They said, can you contact my niece? Can you contact my family? It's sad. And I guess the point here is, we've got to appeal to these families. These patients are well now. All they need is love care and their medication. We are here to provide that, but it's time you took them back. I mean, the same thing I used to tell senior citizens. You just don't dump them. This is not a home, this is a hospital where we care and treat. Once the patient gets better, the responsibility falls back on the family. Unfortunately, there are cases where we'd love the families to come and take the loved ones here. So ladies and gentlemen, coming back to this year's theme, again as mentioned, young people and mental health in a changing world. You'll all agree, at one time mental illness was only for aged. Oh, but now it's changing. There's certain reasons why more and more young people are getting into stressful situations. Technology for one, peer pressure for another, drugs another, changing lifestyles, social media. There's so many things that leads people to stressful environments. And so this year we want to focus on young people. Not only assisting young people get over stress and other issues, but at the same time using young people as champions for this cause. And it's very important that we engage young people in mental health as well. So basically, ladies and gentlemen, this day provides an opportunity for all of us here, all the stakeholders working on mental health, to talk about what you do, talk about the challenges that you face in your daily life, and basically talk about what's there for us in the future. I've been told that overall 1 in 4 adults suffers from mental illness, and 1 in 5 young persons suffers from mental illness. That accounts for about 20% of our population. It may not be that high level of stress, but I'm sure each one of us go through stressful days, stressful situations, whether it be relationships, whether it be, any situation that gives you stress. And sometimes parents are more stressed out because of, like we're talking about, youth in a changing world. The expectations are different now. It's very difficult to control the behavior of children these days. So that also adds up to stress. So like I've said, 1 in 4 adults suffer and 1 in 5 young people suffer from mental illness, and that is something that's alarming for our population. And if you look at lifelong wellness, I think lifelong wellness starts with mental wellness. You need to be mentally stable. Then only you can have a lifelong wellness. And coming back to young people, ladies and gentlemen, like I said, young people get affected by trauma. Sometimes there is transgender discrimination, bullying in schools, and recently we've seen increasing number of suicides as well. We need to find solutions to that to ensure that we don't lose our young people to this. So again, like any other issue, we need a shared responsibility. We will need to, and we will have to make it our business as health workers, as adults, to reach out to as many young people that we can to advocate on mental health. That's very important. We will have to encourage our young people to be strong. We have to encourage our young people to be resilient. And I think we'll have to encourage our young people to communicate more. We've got to communicate. So who do we communicate with these days? The phone. Yeah? The phone seems to have taken away that family communication bit. You sit at dinner tables, everybody's doing something. In the bus, even the cinema, you see people pick up the phone, check. That's technology. So within our families, I'd like to urge people to ensure that there's a phone-free time maybe at the table. I started that and then eventually it died out. But I think as adults we need to encourage. We adults are addicted to our phones as well. It's a good thing. But let's communicate with people. Come on, that's the technology we communicate with. Rather than sending somebody a text, pick up the phone and say, hey, how are you? What's up? Okay, something like that. And that can start within our homes. That's very important. Otherwise, I don't know. In the next 10, 15 years, what's going to happen? Maybe we'll be talking from one room to the next. Hey, mom, what's for dinner? Or what's for breakfast? Or things like that. So that is what we mean impacts of a changing world. We're living in a changing world where I think we are losing that essence of communicating with people. We've forgotten to see people around us. We are so engrossed in what's up there. Maybe good. Technology should be used for our advantage. Technology should not, we should not become slaves to technology. That's what we're basically saying. So again, those are some of the things we need to look at. And like I said, this day gives us an opportunity to pause and reflect, actually on our own selves as well. The work that we do, all the working mothers, all the working, the population here. Go back, spend some time on yourself. Before you sleep, think, how did my day go? How do I solve this? I mean, my line of work, there's stress every second. Okay? There's stress every second. Like I said, I wish somebody asked me how I was. But unfortunately, different jobs require different expectations, and we'll have to deal with that. So do spend some time on yourself, with your families, with your children, with the elderly, with your neighbors. Sometimes you don't even know who's moved in the neighborhood. So the other day I had some children, and I looked at, I have a new neighbor, but I don't know my new neighbors are. We're so busy. So we might have to change our lifestyles as well. It's not only about eating healthy, it's not only about having regular exercise, it's not only about going to work and coming back, it's just about going back to how we used to live. Laughter, smile, joy, what is it? When can you openly share your problems with the next person? Where did we lose that trust that we are not talking to people? So we need to go back to that. And any problem, you should not keep it to yourself, believe me. And to all the young people out here, it's very important that you communicate. You communicate to your elders, you need counseling services. It's all available there. So we need to make use of that. And like I said before, there are a lot of patients who have been cared by the hospital staff. They are still being cared by the hospital staff, and we will continue to care for them till the families come and take them back home, or even if the families don't take them back home, this place will always be a home to our patients. And I'd like to urge the staff to ensure that our patients are given the highest level of care within this facility. I've already talked about changing mindsets, about ourselves, about our families. It's very important. Care and emotional support is also very important. And ladies and gentlemen, we can make laws. We can make a lot of laws, forcing people to take care of their mentally disturbed family members or senior citizens. It might not work. It has to come from here. It really has to come from the heart that she's my mother, or he's my brother, he's my uncle, he's my nephew, niece, and I'm going to look after them. And if we all can make that pledge, I'm sure we wouldn't need a facility like this, but unfortunately we do. Okay? And for families, it's important to understand. So going back there, I'm told that we have 700 nurses nationwide, 700 nurses nationwide who have been trained in the last 2 years through the Mental Health Global Action Plan. And this enables those with non-specialized background to recognize mental health issues and have the ability to treat issues in their own communities. However, I think we will continue with that and see that we have more nurses trained for this specialized care. And this program was indeed funded by WHO, and I'd also like to put on record our appreciation for the World Health Organization in partnership with the Ministry of Health and always being there to support us. Ladies and gentlemen, the mental health focal points in the divisions and subdivisions are coordinating the mental health clinics for our health clients, and they work together with public health nurses to identify new cases and conduct programs accordingly to manage the cases. We have stress management wards in our divisional hospitals, and we are working very closely with our NGOs to provide counseling, support services, and outreach awareness in communities as well. And I'm sure that all of our nurses and staff involved in mental health awareness also need counseling at times, and I'm sure that that support is also provided to our staff. Like I said, you also need to be mentally prepared to handle these cases. And I thank you for all the work that you do. So ladies and gentlemen, life is very precious. It's very precious. And when we come back to the theme with young people, we really do not want to lose any more lives of our young people for whatever reason, whether it's on the roads, whether it's suicide, whether it's drowning. we want our young people to grow up and become productive citizens of our country. And for that, we need a collaborated stakeholder approach, and I'm sure we're heading towards the right direction. So all in all, you'll be hearing more this month from the team about mental health awareness, and we are here to provide you with the support and assistance that you need. Once again, a humble plea to all Fijians that it is also our responsibility. It becomes our responsibility as human beings to ensure that we know what's happening within our home and maybe in the next door as well. I mean, the case that I explained to you is a very sad case. So you have a mother who's blind, and then you have a child, a young son who's mentally challenged. Where is the support system? So support systems are here, and if you're a neighbor, if you're a relative, and you know there's a case in your family, please do bring it to our attention, and we will ensure that we provide the much needed support that the family needs. So all in all, thank you very much, and once again I'd like to reiterate that good health begins with yourself. You need to be healthy physically, mentally, spiritually. You need to be healthy to ensure that you provide service to others who need it. So thank you very much, and yeah, happy World Mental Health Awareness Day. We are not celebrating people mentally challenged. We are celebrating the fact that we are doing all that we can do for our persons suffering with, well, I wouldn't call it mental disability, mental health. Yeah? And so thank you very much, and thank you for being here. And let us go out and do what we can do for our communities and our families and our society. Thank you.